Do you ever wonder if some people with knee osteoarthritis can live pain-free without surgery? It's actually true. If you've been dealing with knee pain, swelling, or stiffness from osteoarthritis and feel like you're stuck in a loop of discomfort, then keep watching this video. Does this sound familiar to you? Have you tried painkillers that seem to help for a little while, but the pain keeps coming back and you're concerned about side effects that are unwanted from these medications? Have you tried injections for relief? They might work at first, they might not, but the pain will always return. Does it feel like surgery is the only option that your doctors suggest? Does that actually scare you? Do you want to worry about having repeat surgeries? And if you've had surgery and it didn't solve the problem or made it worse, what are your options now? It's like you've been searching for something to finally stop the pain, but every turn leads to more frustration. I understand your frustration. I've treated hundreds of patients with knee osteoarthritis who felt like they had no other options. In this video, I'll share proven and effective non-surgical treatments to help alleviate your pain, improve mobility, and get you back to your normal life. Just keep watching. Not only will I describe these non-surgical treatments in detail, but I'll also explain why surgery should be your last resort. You'll learn things that your orthopedic doctor might not have ever told you. Make sure you stay till the end, because missing even one piece of this video could mean missing out on key information that could help you manage your knee osteoarthritis effectively. Hi, I'm Dr. Ruminder Birk, a chiropractor in Woodbridge, Ontario, Canada. With over 25 years of clinical experience, we've helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, and radiculopathy. We also specialize in treating knee conditions like osteoarthritis, cartilage degeneration, and chronic knee pain using non-surgical methods, including knee decompression therapy. Be sure to subscribe if you want more tips on relieving both knee and spine-related pain and learning about therapies that work for these conditions. Now, before diving into the most effective non-surgical treatments for knee osteoarthritis, let's look at why surgery may not always be the best option. Research shows that many people who have undergone knee surgery, replacement surgery, are still experiencing pain afterwards. In fact, about 20% of people report chronic pain even after the surgery. There's also a recovery period for up to 6 months, and the surgery can limit your mobility in the future. And worse yet, the revision rate for knee replacement surgeries is on the rise, meaning people often need a second surgery within a few years. There's actually been studies done, if you've had a scope or not, if you've been recommended a knee scope, where they took two groups of individuals. One group actually got the scope, the other didn't, and the results were the same. The amount of people who have had improvement who actually didn't even get a scope was equal to those who did. So what about pain medication? Many people continue using painkillers long after surgery, increasing the risk of dependency. These facts show why surgery should only be considered after all conservative treatment methods have been tried. So let me share some of the good news with you. Non-surgical treatments for knee osteoarthritis are not only possible, they're effective. And before we get into what those treatments are and our multimodal approach, I want you to understand what the actual levels of arthritis in the knee can be and which ones we can help. So as the knee is normal, we're looking at knee joints that have a healthy meniscus. It's just like a disc in the spine. We've got a cushion in between these that are shock absorbers. They give the knee mobility when they're healthy due to good, healthy knee alignment, and the disc stays spread open. This creates the mobility we need in the knee. When that begins to change, when the knee is either altered through alignment disturbances or early onset arthritis, this is what it looks like as it begins. The disc is getting compressed. In the knee joint, you're going to see a thinner space, and obviously that can lead to irritations, stiffness, arthritis pain begins happening, and the longer it stays that way, the further it degenerates. This is moderate, And then obviously as we get past that point, it gets severe. So severe may or may not be reversible, but obviously we can provide relief. So when it comes to the levels, the sooner the better, obviously. As we catch this earlier in care, we can really create a healthy meniscus space again, realign the joint, rebalance it. We're going to get into what those treatments are next, but I need you to know that this is at levels as it goes, it is reversible to a certain degree. So in our clinic, we use a multimodal approach that really includes a combination of knee decompression, cold laser therapy, specific exercises and adjustments of the knee that specialize in correcting the cause. So the first thing is, of course, the knee decompression. The point of this table is to get to the knee and open up that meniscus we showed you earlier. So if the meniscus is getting compressed, we're going to have someone being on this computerized table. We have a specific program that gently stretches and opens up the knee, creating a negative pressure at the knee joint. This helps increase blood flow, it reduces inflammation, and it promotes the healing of the damaged tissue and cartilage, and as well the ligaments that surround the knee joint. So just creating that pulling effect. The table pumps back and forth. It's gentle. We're going to start with somewhere between 18 to 20 pounds, so it just feels like someone gently pulling on your knee. As that works over time, the cartilage gets pumped again, the fluid comes back in, and that's what restores that meniscus back to its normal health. Studies have shown, and our results in our office match, that patient pain can be reduced up to 70–80% with osteoarthritis when it's combined with our other therapies. We're going to show you the cold laser next. So the second most important part of treatment is going to be the cold laser therapy. It's a non-invasive treatment. It promotes healing at the cellular level. It's going to reduce inflammation, helps with tissue repair. We're going to get into the meniscus. All the ligaments and joints are going to be healed faster by using this laser. The laser is like a warm healing light, penetrating into the tissues, helping the cartilage repair faster. It feels great, and it just really helps relieve the symptoms faster than they would on their own, especially after combining it with the knee decompression treatment. So that's the low intensity laser therapy. So next comes the components of the manual part of the treatment. I'm going to be working on several things. One is going to be the actual adjustment. As the bones rotate, that's ultimately what's created the problem. Many times there's a pelvis problem that we've been adjusting as part of the chiropractic component of this. It depends on if the patient has back pain or not, but mostly if we're focusing on the knee treatment, it's going to be right at the fibula and tibia alignment of that. So when it comes to that, we use special drop tables, they're called, where I use this table to realign without twisting too intensely. We're going to just create a torsion on the tissues, realign that knee joint, bring it back into alignment, so as we do the decompression, it's in the proper position, and it doesn't just go get twisted and compress back down afterwards. So 2 or 3 times, whether it's the knee joint that way or the patella has risen, I use this same table to create an effect to drop the patella lower. The kneecap can be rubbing in most cases, and it gets arthritis on the backside. So as we bring that back down, it's going to help relieve and alleviate the real cause of the problem. Secondary to that, we have rapid release, which is a vibration tool. Real simple. It's used as a calming effect on the muscles. So as the muscles around the knee joint are getting aggravated, they're getting distorted, they're getting tighter, the vibration just calms down, brings a lot of the flushing effects of the vibration deep into the joint space, creating a relaxation into the knee joint itself. And then thirdly, the most important thing is rebalancing. Muscles have distorted, so they've changed their patterns around the knee joint, and they're going to continue to change them back if that's not corrected. So this is called the trigenics maneuver. So what I do with the patient here is a couple of moves, but the first one I'm going to show you is simply getting on the back of the muscles of the hamstring, and have you just straighten your leg for me and relax. Bend it again. And as she's pushing into me, straighten your leg for me all the way down up. Perfect. As we do that, relax again. We're going to find areas along the hamstring that are going to cause this to unwind again. So this maneuver is really about rebalancing the neurology around the knee, resetting those patterns back to the brain, and making this knee stay healthy. So as this is corrected long term, it's not going to keep coming back. It's correcting the cause, rebalancing, realigning. It's the goal of our treatment is to make it a long-term correction, not temporary results. I hope this video has been helpful. You've learned that there are effective, non-surgical treatments for knee osteoarthritis. You now have information on safer, effective alternatives to surgery that can help you manage your condition and improve your quality of life. Now I want to hear from you. What has been your experience with knee pain, and what treatments have you tried that haven't worked? Leave a comment below and please share your story. If you found value in this video, be sure to like it and share it with those in need. And don't forget to subscribe for more tips on relieving both knee and spinal pain and updates on treatments that actually work for conditions like osteoarthritis. Make sure you keep staying tuned for our following videos that will give you exercises on relieving knee pain and improving mobility. Stay tuned.